Hello and welcome to the Genesee Valley Nurses Association blog. My name is Rick Rosati. I'm the newsletter and blog editor for GVNA, and I'd like to welcome you to this video blog posting. Today I'd like to talk about 7 important emergency management principles that every nurse should be aware of in order to keep themselves functional and safe during times of crisis. Thanks for joining us today on our video blog post. Let's get into the 7 things you need to know about emergency management to stay safe and functional in times of crisis. Number 1, know the threats in your community. This is a really broad scope approach to understanding what the leaders and emergency planners in your community are preparing for. You don't have to know the details, but it would be nice to know what types of events are prone in your area and what your emergency planners and leaders are really looking out for. That's going to help you be prepared better as a citizen, as a parent, and certainly better prepared to carry out whatever role in emergency preparedness you play. Number 2, know how to prepare yourself and your family. Why? Well, this is something you need to do ahead of the crisis, and studies have shown that good individual and family preparedness improves the overall response. Even more so, it's important for you to prepare yourself and your family ahead of time for crisis because we want you to be able to come back to work and carry out your duties. It'll be easier for you to do that if you know your family is safe. Number 3, know the indicators and warning signs of an incident. Why? Well, it's important for you to understand that certain events have certain specific indicators or signs and symptoms, if you will. This situational awareness may be all that stands between you and harm if you recognize the problem early. Recognition of the problem early saves lives, including your own. Keep it in mind that someone's going to have to recognize the warning signs of an event, and it might as well be you. Number 4, know your internal emergency plans. Why? Because there's not going to be time to look things up when the crisis hits. And knowing these plans ahead of time, working these plans into your routine training is going to cut down on your reaction time and improve your response. When we cut down reaction time, we improve response and we save lives. We're able to carry out our jobs in times of crisis in a very efficient manner. Number 5, know the basics of the Hospital Incident Command System. Why? You have to have a basic understanding of the Incident Command System and Hospital Incident Command System if you're going to work in that crisis environment. You may have to work in a specific role or leadership position within that environment. And keep in mind that the possibility exists for a provider at any level, from the newest to the most senior, to be thrust in a leadership or command role within your organization. Knowing the basics of an incident command system or the hospital incident command system ahead of time puts you in position to be successful and lead others no matter what your role is during times of crisis. Number 6, know your capabilities. Why? You need to know the resources and abilities of your agency and those around you. This will help you understand how triage will work in your area in times of crisis. It may also give you a leg up on decision making in whether you're sending or receiving patients in other facilities or institutions and how you're working within that triage environment. Knowing the status of specialty care centers such as burn units or trauma units may help you understand what types of patients you might receive should those hospitals or facilities be overrun or have to evacuate. It also might help with your triage decision making when you're sending patients from your facility or from your service to another facility or service. Number 7, know your personal protective equipment. This is not just the stuff you use every day, but knowing the PPE that you rarely use, such as positive pressure respirators or mask-type respirators or filter masks. Studies have shown that annual training may not be enough of these on these devices, and if you use it wrong, simply put, you could be dead. Improperly deploying or donning your PPE gives you a false sense of security. N95 masks, PAPRs, various decontamination PPE has to be put into a routine training aspect so that we can be comfortable with it and almost memorize it when times of crisis strike. Thank you for joining us on this video blog edition of the Genesee Valley Nurses Association. Please visit our main page at www.gvna.us.